name's Haleigh. I'm going to be your nurse practitioner today. I'm going to start by doing a head-to-toe assessment on you, if that's okay. I'm going to start with your hands. Hands are nice and symmetrical, warm to the touch. Great capillary refill, no lumps or bumps present. So I'm going to move on to your head and your face. Face is nice and symmetrical. Can you smile for me and puff your cheeks out? Great. Cranial nerve 7, facial nerve intact. I'm going to palpate. Tell me if you have any tenderness. No lumps, bumps, or abnormalities present. Hair is nice and clean. I'm going to have you clench your jaw. I'm feeling your temporalis and masseter muscles and relax. And clench and relax. Cranial nerve 5, trigeminal motor aspect intact. And can you open and close? That's checking for TMJ, which there's no cracks or pops, so that's great. I'm going to feel your sinuses. Tell me if you have any pain or pressure. Your frontal and your maxillary. No pressure noted. Okay, now I'm going to go into your eyes. Eyes are nice and symmetrical, no drainage. I'm going to start off by doing a test. I'll have you cover your right eye. You're going to tell me when you see my finger. See it? Okay, and the other eye? Okay, optic nerve 2 intact. Okay, so next I'm going to look at the external of your eyes. Can you raise your eyebrows? Great. Eyebrows, eyelashes, and eyelids are all within normal limits. Check your conjunctiva, nice and pink. Sclera and cornea intact. Iris is green. Your pupils are nice and equal. Check your pupillary reflexes.
That's what I'm for real thinking about doing. Yeah. Why don't you just put down here?
Pupils react great. Follow my finger all the way in. Pupils constrict great to accommodation and light. Next, I'm going to do an ophthalmoscope exam on you.
I'll just do it to have it and then.
Well, thank you.
Okay, I can see the red reflex, disc, vessels, macula, retinal background, optic. Okay. All right, so next I'm going to go into your ears. I've started by inspecting. They're nice and symmetrical with your eye high, warm to the touch. Tell me if you have any pressure. I'm going to feel your auricle and tragus. All right, no lumps, bumps, or abnormalities. I'm going to complete an exam on you. I'm going to have you cover your left ear, and I'm going to whisper back and you tell me what you hear.
1, 2, 3.
Okay, and on your other ear, cover your right ear.
ABC.
All right, great. That is checking cranial nerve 8, acoustic intact. Next, I'm going to examine your ear. Auditory canal, nice and clean, no earwax present. Cone of light is at 5 o'clock. Tympanic membrane is pearly gray. I can see all landmarks. Malleus is present. Great. All right, now I'm going to perform 2 tests on you. The Weber and the Rhine test. I'll start with the Weber. It will go on top of your head and it will measure hearing loss. And so you'll tell me if you hear it more on the right, the left, or if they're equal. Equal? Awesome. So that is normal finding. Next is the Rhine. It's going to measure air conduction versus bone conduction. So you'll just tell me when you can no longer hear it. First, I'm going to stick it on your bone.
Okay.
All right. So that's a normal finding as well because air conduction was greater than bone conduction. All right. So next, I'm going to move on to your nose. Nose is nice and symmetrical. I'm going to check for patency. I'm going to have you cover your nostril and sniff. Okay, and the other one. All right, great. It's nice and warm to the touch. No lumps or bumps present. Next, I'm going to examine inside your nose. Get a new tip on here. Okay, septum is in midline, turbinates, and nasal mucosa is nice and pink. Great. Okay, so next I'm going to move on to your mouth and I'm going to inspect it with my light. Buccal mucosa, hard and soft palate, all nice and pink, as well as your gums. Teeth are all intact, nice and white, no decay. Can you stick your tongue? I'm going to look at your tonsils. Tonsils are a +1. Tongue is nice and pink and moist. Can you move your tongue side to side and up and down? Great, that was checking for cranial nerve 12, hypoglossal, intact. Now I'm going to have you stick your tongue out and say, oh, and I'm going to check your uvula. Great, had nice mobility, it constricted up and stayed midline. That was checking for cranial nerve 9, glossopharyngeal, and then cranial nerve 10, vagus. I would check by assessing the gag reflex, but we're not going to do it that time. This time. Okay, so that is it for the face. Next I'm going to move on to your neck. It's nice and symmetrical, warm to the touch, no lumps or bumps present. I'm going to assess all of your lymph nodes, so if you have any pain or pressure, let me know. I'm going to start with your occipital, post-auricular, pre-auricular, submental, submandibular, tonsillar, and I'm going to move down the neck. I'm going to start, superficial cervical. I'm going to have you turn your head this way into your deep cervical chain, and the other way, deep cervical chain, and look straight, posterior cervical. I'm going to have you kind of lift your shoulders up just a little, and I'm going to check your supraclavicular and your infraclavicular. All right, you can relax. Now I'm going to check your axillary nodes under each armpit. Okay, and your epitrochlear underneath your elbow. All right, check your other one. And your epitrochlear again. All right, great. Next, I'm going to palpate your trachea. It's nice and midline, no masses present. I'm going to palpate your carotids one at a time. Okay, now I'm going to listen with my bell. Great. Okay, next I'm going to do some range of motion in your neck. I'm going to have you look side to side, up and down, and shrug your shoulders. Now I'm going to do it with checking your muscles. So I'm going to have you look that way and then push against my hand. Okay, and the other way. And then push here. All right, so that's checking for cranial nerve 11, spinal accessory intact. So next I'm going to have you face, or scooch up just a little. I'm going to come from behind and check your thyroid. I'm going to have you swallow. Okay, and swallow. Great. Thyroid is palpable, no masses present. And that concludes our neck. So next I'm going to have you kind of rotate around, or maybe face your back this way. There you go. Look at your hair. So first I would start by inspecting the back. Skin is nice and warm. Tell me if you have any tenderness, and palpate it. No lumps or bumps or abnormalities present. I'm going to have you take a deep breath in and out. And one more time. Expansion is symmetrical, equal and bilateral. And I'm going to have you repeat 99.
99, 99, 99, 99, 99.
All right, now I'm going to check your spinous process. Any masses? Great. Okay, so next thing I'm going to do is percuss your lung fields. Alrighty, and then next you're going to tell me if you have any tenderness. I'm going to check for CVA tenderness over your kidneys. Alright. right, so no tenderness noted. I'm going to now auscultate your lungs. Every time you feel my stethoscope move, just take a deep breath in and out with my diaphragm. Okay, take a breather. And next I'm going to have you say E every time you feel my stethoscope move.
E, 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 E.
Okay, and the same thing, but 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and one more time, but I'm going to have you whisper 1, 2, 3. Great. Lung sounds are clear, equal and bilaterally. Okay, now I'm going to move to the front of your chest. If you can spin on around. All right, so I'm going to start by inspecting, palpating. Skin is warm to the touch. Tell me if you have any tenderness. Okay, I'm going to have you repeat 99.
99, 99, 99, 99.
Okay, and I'm going to percuss. Okay, and now I'm going to move on to auscultating again with my diaphragm. Just have to take a deep breath in and out. All right, and I'm going to have you slightly lean over a little, and I'm going to listen to your aortic and pulmonic. Okay, no murmurs present, and lung sounds were clear, equal and bilaterally. Okay, now while I have you sitting up, I'm going to go ahead and examine your arms. Arms are nice and symmetrical. No lumps, bumps, or nodules present. I'm going to feel for your brachial pulses. Nice and 2+, and your radial pulses. All right, now I'm going to do some range of motion. I'm going to move your hands up and down, and then put your arms down and move them up and down, and then behind your head. Now I'm going to do it with a little bit of muscle strength. I'm going to have you push up against my hands, and then down, and then have you put your arms up and push against, and pull. Great. All right. So next I'm going to lay you down. Lift your feet up. I'm going to go ahead and do a heart exam, and then we'll move on. Okay. So I'm going to start by inspecting and palpating. Tell me again if you have any pain. I'm expecting the precordium and palpating. There's no pulsations or heaves present. I'm going to feel for the apical impulse at the 5th intercostal space, mid-clavicular line. All right, and now I'm going to grab my stethoscope and go ahead and listen to your heart and count your apical heart rate. So first, I'm going to start with my aortic with my diaphragm, 2nd intercostal space, right sternal border. And now I'm going to listen with my bell. Okay. Now I'm going to listen to the pulmonic, 2nd intercostal space, left sternal border with my diaphragm. And now with my bell. All right. And then Erb's point, 3rd intercostal space, left sternal border with my diaphragm. And now with my bell. Okay, now tricuspid, 4th intercostal space, left sternal border with my diaphragm. And now with my bell. And now move to your mitral. Fifth intercostal space midclavicular line with my diaphragm. And now with my bell. Okay, now I'm going to go ahead and count your apical pulse. Okay. And probably your heart rate's about 72. So while you're laying here, I'm going to go ahead and examine your stomach. Do you mind if I pull your shirt up a little? Oh, that's good. Okay, so first I would do by inspecting. Abdomen is nice and flat. Skin would be warm to the touch. Okay, for this I'm actually going to go on and just go ahead and auscultate first. And just all 4 quadrants. Vowel sounds are normal active. Now I'm going to percuss. I'm going to percuss your spleen. All right, and your liver, which is at the right midclavicular line. Sorry. Actually, I need a pen and ruler. Maybe about here. Do you care if I mark on you? Okay. Sorry. I'm pulling your shirt up. Okay. Get my ruler. Okay. Oh, right on the dot, 7 centimeters, which will be normal in females. All right. So next I'm going to start by palpating. Light palpation. Tell me if you have any tenderness. Okay, I'm going to do some deep palpation. All right, great. Now I'm going to palpate for your spleen. Take a deep breath in. Okay, and breathe and relax. And I'm going to have you do one more deep breath in. I'm going to palpate for your liver. All right. Okay, now I'm going to palpate your kidneys. Okay, and your aorta. Okay, now I'm going to listen to your arteries and your abdomen. We'll start with your aorta. And your renal. And your iliac arteries. And your femoral. And in a real exam, it would be skin to skin, but for the purpose of the video, we're moving clothes on. Okay, so since you're lying down still, I'm going to move to your legs. That's it for the abdominal exam. Legs are nice and symmetrical. No lumps, bumps, or abnormalities. Skin is warm to the touch. No edema present. I'm going to look between your toes. Okay, I'm going to check for some pulses. Your popliteal. Your posterior tibials. And your dorsalis pedis. Great. Okay, so I'm going to do a little bit of range of motion in your legs. I'm going to have you lift each leg up one at a time. Great, and then do the same thing, but bring your knee in each time. Awesome. Now can you move your feet up and down, check for your ankles, and then do the same with your toes. Awesome, great range of motion. Okay, I'm gonna go ahead and sit you up. And we will do a neurological exam. Okay, so I'm gonna start off by having you close your eyes, and I'm gonna have you say now when you feel something.
Now.
Okay, ophthalmic branch intact.
Now. Now.
Maxillary branch is intact.
Now. Now.
And mandibular branch is intact. And you can open your eyes. That was checking cranial nerve 5, trigeminal, the sensory aspect of it. I'm also going to do another light and pain sensories in your arms and legs. So I'll have you close your eyes again and tell me if you feel dull or sharp.
Dull. That was sharp. 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 Dull. Sharp. Sharp.
It's hard to close. Okay, under your feet.
Sharp. Dull. Dull. Sharp.
Okay. Great, so just missed a couple in the arm, but with the clothes on, it's kind of hard. Okay, so next I'm going to do a couple tests. I'm going to put a couple objects in your hands, and I'm going to have you tell me what they are. Okay, so I'm going to place an object in your right hand.
Key.
Okay, and then your left hand.
Paperclip.
All right, so that's checking for stereogenesis. And now I'm going to do position sense. I'm going to move your finger up or down. You tell me if it's up or down.
Up. Down.
All right, your toes.
Up. Down.
Okay, so I'm going to do a couple more neuro exams on you. I'm going to have you take your heel and move it from your knee down to your ankle and repeat on the other one. All right, now I'm going to have you do rapid alternating movements for your hands. All right, that's intact. I'm going to move your chair down to the ground so I put you up. I'm going to go ahead and check your deep tendon reflexes, and then I'll have you stand and do a couple more exams. So first I'll check for your your bicep. Okay. Okay, and then your tricep. All right, great, and your brachioradialis. Okay, I'm going to do the same on the other arm. Bicep. And your tricep, go to relax it. Okay, and brachioradialis again. Sorry. Well, that one was good. Okay, now I'm going to move to your patellar. Okay, and your Achilles tendon. Okay, now I'm going to check for Babinski reflex. All right, great. Okay, now I'm going to have you stand and go back to the wall. I'm going to have you walk down on your heels and then back on your toes. Great, and now I'll have you face this way with your feet together and close your eyes, check for Romberg's. Awesome, you can open your eyes. Now I'm going to have you turn around. Sorry. And I'm going to have you kind of lightly bend your knees and then bend over. And while you're down, I'm going to go ahead and check for scoliosis, kyphosis, or lordosis. Spine is symmetrical and intact midline. You can turn back around, sorry. So now I'm going to have you hyperextend your spine and then each way down and side to side. Awesome. So I was checking for range of motion of your spine. So I think that concludes our exam. Do you have any questions for me?
No, thank you.
All right, thank you.